Naji Gehchan, Chief Medical and Development Officer at Kyverna. We're working at Kyverna pioneering the field of CAR T in autoimmune diseases and specifically in autoimmune neurology, where our first indication is stiff person syndrome, where we are very proud to disclose the data of our pivotal trial at AAN as a late breaking. And myasthenia gravis, our second indication, where we shared our phase 2 and moved into phase 3. So stiff person syndrome is a rare disease that touches the GABAergic system. So basically, when you're contracting one muscle, the other muscle relaxes for you to be able to contract. In this disease, unfortunately, the inhibition of the inhibition is not working. So both muscles are contracting at the same time. So what this leads to is stiffness, as the disease is called. So stiffness, spasms that are painful. There is the statue posture that is also known, with impact also on psychological impact too. So fear of falling, anxiety, phobias, also due to the GABAergic system being touched. So the disease itself, it's clinical plus antibodies. So it has been shown it's the GAD65. The anti-GAD65 are the most prevalent antibodies that's correlated with the disease, and glycine R. So these are the two that are correlated with it. As of today, there is no approved therapy, unfortunately, for those patients. So what end up doing is immunomodulator. So patients will receive IVIG mostly, some rituximab. There was a trial done in rituximab that was not positive, but still there is some impact on rituximab, but all of these are off-label. So it's a phase 2 registration trial that we did. Miv-cel was positive on all the different endpoints in the trial. So our primary endpoint was time 25 foot walk, so really looking at mobility of those patients, because it's a progressive disease. So patients end up, 80% of them unfortunately end up needing walking aids, wheelchair, bedbound over the course of their disease. So we looked at the time 25 foot walk improvement in those patients, and it was highly significant. Our secondary endpoints were looking at both disability, that were also highly statistically improved, and also specific endpoints for the disease, which are stiffness index and heightened sensitivity scales that look at triggers those spasms with the patients. And both of them were highly positive also in the trial, which was not seen. So for these two specific, it was not seen even in the trials done in the off-label therapies used. Well, I would say what's really remarkable as it was reading out, and when you hear our investigators talk about it, there is a reversibility of disability. That is something usually we don't see. So this population unfortunately progresses even under off-label therapies. And what we've seen in our trial is patients who needed walking aid at baseline, 2/3 of them ended up not needing walking aid at the endpoint. And this is truly something remarkable that was not seen before in the field. So we're really now working, obviously, to bring this to patients as we move forward. So there are scales mainly used, so MRS, Modified Rankin Scale, it's a scale used in stroke, for example, that looks at disability. The other we're using is Hauser Ambulation Index. So it's a mix of time 25 foot walk, where you ask patients to walk 25 feet back, forth, and you average this time, plus the ambulation aid. So unilateral, bilateral aid, and walking aid or wheelchair. And we will be, well, the data that we shared in the conference shows the shift plots where you see ambulation getting better. So patient needing aid, not needing aid, patient walking slowly, now walking better. In our trial, it was improved 43% improvement in the walking speed and the disability we talked about, but really 30% of patients, basically 1/3 of patients, were walking at a healthy walking speed at the end of the primary endpoint. certainly Celine Dion being public about it helped bring light to this disease and bring more. She has the Celine Dion Research Foundation, for example, that was here, so more research also to understanding this disease. This disease has been studied for several decades now, 3 decades, but still a lot needs to be understood. So I would say it really shed the light on what the disease is, and us being able today to have a therapy that we're hoping we'll be able to bring it as a first therapy for this disease will also kind of help move the field forward and help patients finally be able to have more hope for them to be treated.